The West Cancer Foundation offers free life-saving services to cancer patients in need in our community, and now they are offering a new form of counseling, not only for patients but caregivers, thanks to a partnership with Alliance Healthcare. To learn more about this program, we are live with the president of the foundation, Leanne Soden, along with Emma Blau, a therapist with Alliance. Thank you so much.
Thank you, Kanji.
Wow, you're always doing something. Okay, so Leanne, tell us about this free counseling that you're offering, and how this partnership came about, and why to cover both areas.
Sure. We had a board member that is also a cancer survivor, and he was at our Union location, the Regional 1 West location, and he saw firsthand some of the people that were really struggling. And he came to us and he said, "I'll give you $100,000 if you want to start this program." So we said, absolutely. And we started learning more and more about it, talking to a lot of the docs in the community and how important it was. Mental health still had a little bit of a stigma, but I think we're getting so much better about talking about it. And especially when you're a cancer patient, you're going through, it is so difficult, and the caregiver is sometimes overlooked because they're trying to take care of the patient. And then we have a terminal diagnosis that's even tougher on the entire family.
Wow, and so you're on the front lines, Emma. Why is this so important? What are the things you see?
So I have had the opportunity to work with both caregivers and survivors, and so it's really opened the door for people to be able to come in and talk about how difficult things are in their personal lives, including beyond the actual treatment. So we know it takes a toll on them physically, but as far as mentally, it's just a lot to go through. And so to make sure that people feel supported and feel like they have a safe place where they can come and talk about, the darkest things, the things they feel insecure about, and confront the reality that sometimes it is a terminal prognosis, and how to navigate surviving through what's left and making the most of that. And then for caregivers, they're often forgotten about, right? They're busy taking people to appointments.
Because they're healthy. Right?
Yes,
Mm-hmm.
But it takes a huge toll on their mental health as well. And so everybody just needs a space to be able to come and talk openly. So this has been a huge, huge, huge success so far, and we're really excited to get to continue doing it.
All right, so Leanne, let's talk about this, the greater picture. I mean, let's talk about what you do at West Cancer Foundation, and then how this just kind of fills in a very important gap.
It is a very important gap. We do a lot of services, about our free programs. Everything we do is completely free to the patient. We even pay the copay on some of our programs if the patient can't afford it, has insurance but can't afford the copay. So they're all free, and that's the message we try to get across, that people who need us, they need to know about the incredible resource we have in this community. You've talked with us about one thing we love is our Sweet Wig Beauty Boutique.
Yes.
That we love so much.
Yes.
And we have transportation, which has grown exponentially, already up 20% year over year on our transportation free rides for patients. Lymphedema, garments, wraps, bandages, post-mastectomy, prosthesis, undergarments, breast screenings. We launched our prostate screening program last fall, and this has been a tough one because men, when you tell them prostate screening, they look at you, they don't want to look at you.
Yeah, they're like, oh no, what?
And it's just a blood draw. It's a simple blood draw.
Oh, okay, boom. Okay, and so when someone gets this diagnosis, I mean, first of all, you're like cancer, right? You hear people when they are not well, there is a depression that can set in.
Yes.
And so what are some of the things that you do to try to lift people's minds in this type of space?
So it is something that causes anxiety, depression, fear, insecurity, uncertainty. And so working with people to refocus on what time they do have left, and that especially for those who it's not necessarily a terminal prognosis,
right.
Reinstilling that hope that this isn't an end for them, and that we can kind of work through the treatment, and that it will all be worth something because they've gone through this huge battle.
Right. Yeah.
So just instilling hope.
Yeah, and doing it clinically.
Yeah.
All right, tell us about the big event.
Yes, so we need money to pay for all these free programs.
Yeah.
And our signature event is West Fight On. This is our 13th year doing
wow.
it. And we're really excited about it. Shelby Farms Park, September the 6th. You can run a 5K. You can walk a 1 mile walk. You can ride or your bike for 20, 40, or 60 miles.
Oh, woo.
Yes.
They do this. People do this.
Yes.
They love it.
Yes. We have about 2,000 people there.
Wow.
And we're excited about this year. It's going to be bigger than ever. And we have a survivor ceremony, which is wonderful. That's to us, the most beautiful thing. And the word survivor is so beautiful to us.
Yeah.
And we also, in the morning, we have a remembrance. We have a moment of silence for those who've lost their battle to cancer. Right. And so it's a really great day. It's a community event. We have all of our partners across the community coming out with us. So please come and join us September 6th, and you can find more about it at westfighton.org and westcancerfoundation.org.
All right, Leanne and Emma, thank you so much. You guys are hitting it at all fronts.